Guys, today we will explore electrical stimulation in the human body and how it has sparked numerous claims about its potential benefits. We will also explore these claims and discuss potential advantages and disadvantages. First off, let's define what electrical stimulation is. It's also called electrostimulation, and it's the process of applying a fixed amount of electrical impulses to certain areas of the body. Most commonly, they're going to be in muscles and nerves. Dr. Ho and news outlets like Medical News Today claims that you can gain muscle strength, which could be a valuable tool for athletes and rehabilitation for individuals recovering from like post injuries and post surgeries. Another common claim made is the reduction of pain. Some electrical stimulation systems claim to improve the circulation of blood along with oxygen intake and caloric expenditure. Further in the video, we will explore a bit about Dr. Ho and his products. We will also dive deeper into studies from Joshi, which talks about the effectiveness of myofascial release and high frequency transcutaneous electrical nerve stimulation, or TENS, for pain relief and functional improvement in college students with trapezius myaglia, and a study from Dahali, which explores electrical stimulation and muscle strengthening. The last study we will explore is a study from Kelmer, which explores the efficiency of whole body electromyostimulation on body composition and muscle strength in non-athletic adults.
A lot of sources like to claim that you'll get swole or buff using electromuscular stimulation. But is that true? Well, there were studies conducted, a meta-analysis and a systematic review just to see what the effects were. One of the most commonly used muscles for electromuscular stimulation is the quadratus femoris. Therefore, they tested that on uninjured patients and injured patients in comparison with A, no exercise, or B, with traditional resistance training or strength-based exercises. What they found? Well, it's better than normal no exercise at all, but it's worse than traditional resistance-based exercise. So what can we draw from that? Well, we can draw that A, you can use this in cases where the patient's immobilized. For example, if they're in atrophy from a coma or from having a cast on. Moreover, if they have low patient compliance, then this can also be used. Just any cases where the patient's not able to do that, it's best to use this kind of training. However, in cases where the patient is able-bodied, they should use the normal strength-based training. Finally, this study did come with flaws like every other study. One flaw in particular was that it was across many studies. This meant that some of these studies had low levels of statistician or assessment blinding. Moreover, they lacked follow-up or just general statistical procedures. So some of these results are inconclusive. Overall, just do the strength training.
So, diving into exploring innovative methods that promise relief for those battling musculoskeletal discomfort. Transcutaneous electrical nerve stimulation, also known as TENS, is a non invasive technique known for alleviating various pains from musculoskeletal to neuropathic discomfort. How does it work, you may ask? Well, TENS blocks C fibers in the spinal cord, which intercepts pain signals to the brain. Not only that, but it also triggers the release of endorphins, which are natural feel good chemicals in our bodies that help provide pain relief and reduce stress. Interestingly, not all TENS act the same way. Low frequency TENS is effective in the realm of chronic pain or long term pain, while high frequency TENS takes the lead in acute pain situations. Recent research by Joshi and team, showcased in 2022, shows the power of electrical nerve stimulations in the traps muscles. Comparable to myofascial release, both TENS and myofascial release prove to be valuable in pain relief. However, there is a catch to this study, as the study focused on a specific group of college students aged 18 to 25, meaning that anybody over the age of 25 is still unclear what the effects would be on them. The effectiveness was gauged using a numerical pain rating scale, where participants rated their pain severity from 0 to 10, 0 being no pain to 10 being unbearable pain, and a neck disability index assessing how neck pain affected their daily lives. Yet, let's acknowledge a potential weakness of this study. Individual perceptions can be influenced by various factors, such as the placebo effect. In conclusion, in terms of TENS technology, we recognize its potential in providing relief, but as with any scientific journey, the quest for knowledge continues.
Let's indulge and eat everything. Why? Because these abtronic machines, these electrical muscle stimulators, say they'll burn fat just by putting a pad on your stomach. But how do we know that's true? Well, we got to look into it. So, a study was conducted. They used a lot of participants, both female and male, to see how this is true. We used the Femnique and the Abtronic machines, both set to full-on Fat Blaster mode. You know how many calories it burned if we use the data and estimate a 24-hour period? That's right, 36 calories. That's less than half a slice of bread or a single almond. You know why? Because these machines weren't doing much. All it did was it boosted heart rate levels so tinily you can throw that away as some statistical phenomenon. Moreover, the oxygen rate barely increased by 0.05 milliliters per kilogram per pound. That's it. So, why is this? Well, we think it might be due to placebo. Why? The subjects were all asked at the very end of the study to rate how they felt, how sore they felt. They all felt pretty sore despite no work being done. This is probably because they thought they were burning fat, and that's why they felt sore. Moreover, the study itself isn't very conclusive at all. For example, the participants initially all had low body fat. That's not the people they're aiming for. They're aiming for people with high body fat. And even though it made the study a bit easier, we can't really trust results at all. A lot of outdated studies may say it's better, but all the recent research that's not out of Yugoslavia, it says this does nothing, if not maybe a tiny bit. So, in conclusion, don't use this for fat loss, just work out.
In regards to the conclusion of the validity of the products claimed, Dr. Ho's pain therapy system and medical news today, some of their claims are fully supported by our studies and others were seen as false. According to two of our articles, Bax AL and Joshi AL, TENS and EMS devices can be used effectively rather, and relieving pain on the muscle that the device is working on. This would allow the machine to be used for everyday use, whenever you acquire acute soreness, pain, tightness in your muscles. It could also be used for post surgery to aid with recovery or any kind of sports injury or just daily soreness that you're dealing with. Um, when compared to no training, electrical stimulation is more effective in developing muscle strength and could produce compounding effects if combined with voluntary training. In terms of blood flow, applying TENS or EMS devices on a particular muscle will help increase blood flow, circulation, and blood flow in that muscle. A false claim that we found commonly made by companies advertising these devices are its capability of toning muscles and fat loss. Everyone wants a six pack, but doesn't want to put the work in. The majority of these claims by Dr. Ho's pain therapy system and medical news today are supported by the research done in regards to these claims. For individuals who may be physically limited, require special consideration for their unique needs, TENS may be an effective method for pain reduction. Overall, the critical analysis emphasizes the need for careful consideration of study limitations and individual factors when assessing the effectiveness of electrical stimulation.